Hello everybody, I'm Dr. Amalfitano. I'm a board certified periodontist. I limit my practice to periodontics and dental implants, treatment of periodontal disease, and placement and reconstruction of advanced implant cases. Well, welcome today. Well, I tell you what, let's bring up a little video here. So we'll start out with this little model here. You can see the amount of material that's associated with a complete denture, and I want you to compare that when we start looking at the full arch reconstruction on our model. So typically an upper denture is held in place by suction, the moisture in the mouth, the softness of the tissues. There's nothing really holding it in. And patients' experiences with these are different based on the form of their arch. The more bone loss you have, the harder it is to wear one of these. Another problem with this, which I'll probably highlight again, is that there's a real big thickness of material here, covers the roof of the mouth. Sometimes that can affect your taste, as temperature sensation actually travels through the palate. And a lot of people with upper dentures lose a little bit of taste or the sensation of heat and warmth with foods because of the amount of acrylic that covers everything. So this is what a typical denture looks like. The new model that I'm bringing in here is what a full arch reconstruction looks like, so you can start to get familiar with that. The first thing you can see is that there's 4 little screw holes on top. There are implants that are placed, and we tilt those implants so that we can avoid vital structures like sinuses. And so you can see it's a lot smaller than the complete denture is. Now this here is a little screwdriver that we use to detach the fixed full arch. You see I'm just unscrewing that here with a special screwdriver. They're very tiny screws. In this particular case, there's about 4 of them. In our cases in our office, we try to get 6 implants in on the upper arch. Sometimes we get 5, sometimes we get 6, sometimes we get 8. And you can see here that little screw on the tip there, and I'll pull that off there. You can see how tiny that thing is. So we'll continue with removing the screws here, just to show you what the underneath of this looks like. It's nice and smooth underneath. There's no palatal acrylic. And then you can start to see the implants that are implanted in the jaw. Again, we tilt some of them to avoid some of the sinus cavities. And if you have enough bone, then these standard style implants can be placed and provide a sturdy foundation. Now in our office, when you come in, a lot of times we can take the teeth out, place implants, and usually the next morning I'll have this upper arch created. We have all the equipment in our lab to do so. So this has to come out periodically for cleaning, and it's really individualized. But you can see here the difference between these 2 devices. Now when we replace these or put it in for the first time, we put in all the screws, being careful. They're all torqued down to spec, and for those of you who know what a torque wrench is, we have little micro torque wrenches that we use, and that helps prevent screw loosening. Sometimes the screws can loosen and we need to go in there and tighten them back up again. But again, it's kind of an individual thing on how we think you're doing. If we feel like we need to remove it, we will. Here we're putting in the last screw here, so in this 4 implant reconstruction, we're tightening up the screw here. And now you can see that is screwed into place. It is very tight. I'm putting some pretty good pressure on this, and you see it's not coming out. Well, the reason it's not coming out is because it's screwed into the jawbone. So you can function like normal. I always tell people to take it easy with it. You don't want to break it. You don't want to overload the implant, so you don't want to have an extremely hard diet. You still want to take care of these. I think if you do so, then the longevity of the implants will be a lot longer. So let's compare the 2 again. You got the big denture. Can function for a lot of people, do okay with this, but I think a lot of people just kind of suffer. So here you can see the difference between the complete denture on the right and the fixed reconstruction on the left. You can see how much material will be in your mouth with the denture versus how much material will be in your mouth with the fixed reconstruction. So I hope this little demonstration video helped you understand what the difference is between a complete denture and a fixed full arch reconstruction. Patients notice that there's very little in their mouth. It's screwed down into place. It doesn't come out. There's no embarrassment of it falling out while you're talking. You don't have to go remove it after you're eating. We have specific instructions for you on how to take care of it. So overall, it's just a better reconstruction than a complete denture. Again, there are a lot of people that do fine with a complete denture, but I think there's more than half that don't do very well with it and kind of suffer quietly. So I really want to thank you all for joining me today. I hope this little instructional video showed you a little bit about what the differences are between a complete denture and a full arch fixed reconstruction. You know, it really can be transformative to move along this route. A lot of people silently suffer with their complete dentures, and transformation with full arch fixed dental implants can really improve the quality of life. If you have any questions, please feel free to ask them below and I'll try and answer them. I just want you to know that our practice is dedicated to completing these types of surgeries. We also have a dedicated in-house lab with some of the most advanced technology available. I wish you good dental health.